Have you ever gone to the App Store hoping to find an app that will do the one specific task you need to be done right now in your medical practice, and moments later found yourself scrolling through page after page of really interesting apps and games that have nothing to do at all with what sparked your search? Stay tuned to find out a better way to discover medical apps that serve you as a doctor and health apps that serve your patients in 3 easy steps.
Welcome to the Doctor's Mentor Show. If you believe that medicine is an industry and not a profession, if you enjoy submitting complex reimbursement claims, or you would do another residency just for fun, be advised, you're about to be offended. You should probably leave now.
All this talk about mentoring doctors is ridiculous. I thought doctors learned to do everything better than everyone else the first year of medical school. At least that's the way they act.
If you love assisting patients with vitality breakthroughs, if the right to practice medicine without interference is important, and you want expert tips for practice freedom and profits to support your epic life, welcome aboard and prepare to be blown away. The Doctor's Mentor Show starts now. Here's your host, Dr. Lori Barr.
How did you feel when you did find the app you were searching for and then got sucked into looking at all of the other apps that developer had for sale? Have you ever done that? As a doctor, you may enjoy these virtual excursions as a way to interrupt the patterns and habits of your days and nights at the hospital. Yet sometimes you probably ask yourself, like I do, is there a better way to find apps that will help my patients take better care of themselves and apps that can inject more ease and fun into my practice? Good news. The answer is yes.
Today's topic.
Productivity. Before I share the 3 easy steps that will help you find the apps that simplify your practice and help your patients with more ease and fun, I want you to understand the current trends in medical practitioner app usage. And the best way to do this is to read Ventola's excellent review titled Mobile Devices and Apps for Healthcare Professionals, Uses and Benefits. Now, the reference for this article is in the show notes, and it's also on the blog post on thedoctorsmentor.com.
There's more to explore at thedoctorsmentor.com.
This article gives you the current statistics on utilization, and it also describes ways to improve your personal and professional performance by using your smartphone or tablet. Now, this article is recognized as a standard, and it has been ever since it was published. This article is the benchmark that other articles point to. There are 331 citations of this article since it was published a couple years ago. It's a great article, so if you look at it, it really will give you those current statistics. And if you look at those articles that have cited this reference, you'll find interesting studies on the use of apps by medical students, anesthesia personnel, various segments of the population affected by diverse diseases such as multiple sclerosis and bipolar disorder, and many more ways that medical and health apps are being integrated into the daily lives of health professionals and their patients. So are you ready for the 3 steps? Step number 1, access a searchable clearinghouse of app reviews when you want a list of apps that perform a certain medical or health function. My go-to choice for this is the Mobile App Center at pdr.net. Yeah, you know, physician desk reference, that pdr.net. Go there, log in your medical information, and go to their Mobile App Center. You can set it up so it'll give you notifications when new apps in your specialty come available. You enter your search parameters on the Mobile App Center website, and up pop the matching apps sorted alphabetically along with the date that they were reviewed, a rating, and who performed the evaluation. Many of the app reviews are written by professional medical writers instead of doctors on this site, and I've found their reviews are accurate and useful. I love this site. Step number 2. Stay up to date on the latest health technology releases by signing up for the RSS feed or newsletter at imedicalapps.com. iMedicalApps is an interesting site to watch. They're monetizing their site now. It's a very, very smart little website, kind of like Kevin MD. So 12 of the 16 staff members at imedicalapps.com hold advanced degrees, and they also have 4 staff writers. It's a blog-based content curation site with a members forum. And like I said, look at the way they're monetizing themselves. It's very much under the Kevin MD model, which is a standard model that has been successfully used by healthcare professionals to move from just casual blogging to actually monetizing your blog in a big way. Now, what's interesting about imedicalapps.com, the members forum, it's a great place to ask questions about medical apps. When you perform a search, you get a list of blog posts that contain the topic you searched for, and the search can be filtered by specialty and platform. You still have to read each post, though, to find your matching search terms, so this complements the information from PDRnet. The site is great for discovery of new apps or for exploration of certain nuances of apps where you have that member base that you can ask questions to, the forum base. Step number 3, plan some geek time. I am sure, since you went to medical school, you have some friends who are tech geeks. And if you can't think of anybody, just think of the people in your class that went into radiology, because I guarantee they're closet tech geeks. And as you know, I podcast from my closet, so here I am in the closet recording as I'm calling out the tech geek in all radiologists. So yes, closet tech geeks. And, make a list of those tech geeks that you know. It may be the doctors at your hospital that are in the radiology department. It may be people you went to med school with. It may be people you were in residency with. And seek them out and decide on a time and place to get together. And if you can't do it that way, start a meetup group. And just like you make time for a poker night or spa days or a journal club or a gourmet club, make time for a meeting of your techie friends and colleagues. Take turns pulling out your iPad or your Kindle Fire and look at the health and medical apps you're using. Look at what you consume, compare notes on how you're using them, and explore, have fun. Get somebody who's using that app to show you how they use it and why they love it. There are over 100 medical diagnosis apps in the iTunes Store and 149 medical diagnosis Android apps on Amazon. Lots of choices out there. It's so fun to explore with other tech geek types. And if you're not tech geeky, that's okay. You'll really make the day of your techie geek friends who you invite to these events. So I encourage you to do that. As you get more current with medical app trends, you begin to notice that your trips to the App Store are more focused, and guess what? It's more fun because you're getting what you're looking for.
Your next step.
Your next step is to go to thedoctorsmentor.com and look at the show notes for this show so that you can get the link to that article that I mentioned, Mobile Devices and Apps for Healthcare Professionals, Uses and Benefits by Ventola. Excellent article. So definitely read that article. Also, you'll find the hyperlinks that list the ways that has been cited, so you can look at Google Scholar and see immediately all the different articles that have cited it since its publication. That is fascinating to explore. I know, I'm sounding like the tech geek right now, but it really is fun. And remember, us radiologists, we are inquisitive types. Join us in that curiosity hunt. It's really fun, and it's a good way to lighten up if you've had a hard day. So also, go to thedoctorsmentor.com and click on the link at the right-hand side of the page and leave me a voicemail with your favorite app that you'd like me to share. And while you're there, join the Doctors Mentor community so we can geek out together if you can't find anybody local to geek out with. I'm Dr. Lori Barr, the Doctor's Mentor, reminding you that one idea is all it takes to change your world.
Are you stopping at a hospital? Hello? Don't you know that hospitals are one of the sickest places on the planet? Don't touch anything in there and get out as fast as you can.